let's do that. Okay, well, let's give that a go. So thanks for the article, for writing that.
Oh, yeah. Yeah,
And
of
a
course.
nice, clear, like, delineation of everything. I find a lot of people book with us because of hair loss, right? And I think a
Yeah.
lot of people think the hair loss is hormonal for sure. Like they've already
Yeah.
decided that that's what it is,
Mhm.
but what it's not always that. So what do you think you see in practice a lot? Like just run us through the different types of hair loss, the causes of them, and what you commonly see in your practice.
So, I mean, there's so many causes of hair loss, so it is a nice, it's nice to do testing just to know for sure. But probably the most common cause that I see in practice is stress.
Yeah.
And I'm sure you do too. Like stress impacts us in so many physiological ways. And yes, we can always test for the stress hormones as well, but even just acknowledging it in that intake can be helpful. But then ruling out the nutrient deficiencies, that's a very common one, insulin resistance, hormonal fluctuations like PCOS, menopause, hormonally sensitive times in someone's life too, like the postpartum era or during pregnancy can definitely trigger it. If somebody's been, just recovering from a traumatic illness, a surgery, some sort of big trauma, or even medication, certain medications, whether that's, I mean, I think a lot of people know like chemo and things like that would cause hair loss, but going through like a very thorough intake to figure out all of those things just to rule out all the others. And then thyroid, that's another really common one too. Um,
Mhm.
I've seen a few alopecia areatas, like the autoimmune type, where that's the immunological piece too. So I do like to screen for that, but we can also um, kind of rule that out in some ways if somebody's not presenting with the hair loss coming out in little patches and it's more diffuse. If it's patchy, especially in like the eyebrows or eyelashes and on the scalp, then that can be an alopecia areata, and then looking at the autoimmune markers can help. Um, so yeah, there's so many triggers. Diet is another big piece. Like if people are just undernourishing their bodies, not enough calories, not enough protein, iron, zinc, B12, like all the nutrients, right? So we can always test for those for a lot of them. And then even doing a chronometer to assess somebody's caloric intake can be helpful too, to figure all those things out.
Yeah.
So yeah.
And in the pandemic, I saw a lot of hair loss related to either COVID infection or COVID vaccine.
Yeah,
But hair
that's
loss was
another.
transient in those cases. Like it always seemed to come back. And basically patients were booking in just to make sure there was no other cause of it. And then kind of by the time we've rolled through all of the testing and everything else, their hair was kind of regrowing. And we're like, okay, everything else has been ruled out and it's recurring. Like I think you're fine now. But it was just
Yeah.
really interesting to see with that virus, like the
The
different
post-viral.
manifestations. Yeah.
Yeah, it's so true. That can definitely be a post-COVID symptom or any type of viral infection. It's a
Mhm.
stress to the body and the immune system.
Yeah.
Um, yeah, so it's not cookie cutter with hair loss. You kind of have to do the investigations, but there's lots.
And it's a symptom people care about a lot, right? Like they see that as like a measure of their health, and so it kind of is.
And I mean, the genetic piece, I didn't even mention that, but there's a lot of like, well, male pattern baldness is the hormonal, and then female pattern baldness too.
Mhm.
And there's things we can delay that progress with, even with like topicals. And
Mhm.
yeah, but sometimes the genetic pieces are the harder ones to fully get rid of.
What do you think about the laser caps, the laser
Oh,
helmets?
like the red light therapy.
Yeah.
I like them. I think I've seen some good effects with them.
Yeah.
I even use just like I recommend somebody get like just a general red light, and then they can hold it over any part of their body. So then
Oh
I'm
yeah.
spending the money to use it for arthritis or acne or wrinkles too. And then
Amazing.
they also get their scalp. I use one myself.
Yeah.
So.
And it's a really good one, especially if it is the genetic factor hair loss. Like otherwise, there's not a ton that we can do except for stimulating the follicles as best as we're able. So,
Yeah.
but it's
Yeah.
expensive. It's not cheap to buy one of those, but at least the patient knows that it's a treatment option available to them.
Yeah. And you have to do it like religiously. It has to be done every day. But
Oh, every day. Okay.
Mhm.
Okay.
Yeah,
That's a lot.
that's usually how I start it. But yeah, you do see effects, but after like 3 months. So you have to be like pretty persistent.
Yeah. Yeah. Okay. Well, thanks for that summary.